In April 2020, the website Nursing Notes alarmingly reported over 100 healthcare staff had died, with over 70% being Black workers. So here we are as Black workers facing a pandemic, disproportionately high infection and death rates, and no meaningful enough response. We decided to have a strategic response to identify known risks and provide interventions. UNISON Scotland commissioned a survey to analyze the experience of Black workers as compared to all workers engaged in COVID-19 work across health, social care, and local government. What did we discover? Alarmingly, we discovered a climate of fear, fear of speaking up, fear of dying from COVID-19, fear of infecting family members, fear of no access to PPE, fear of job loss, job costs, loss of pay. Black workers found themselves overexposed to the virus and underprotected compared to white counterparts. We concluded that Black jobs kill, bad jobs kill, and therefore fair work will save lives. So Unison Scotland decided to have strategic interventions. We created an equally safe plan promoting safe work for all, and we shared this across all organizations. We updated our health and safety training module with an equalities focus, and we tried to recruit more Black workers to become health and safety officers to promote safe working. We had a seminar on racism as a public health issue, and we also contributed to the fair work policy. But we can't do this on our own. This work was shared widely. The Scottish Government, in response, developed a risk assessment protocol for all workers across Scotland. We also formed an expert reference group on COVID-19, that's Scottish Government, and the Scottish Government's Programme for Work Protecting Scotland, Renewing Scotland includes recommendations raised by this expert reference group. BEMIS, a member of that expert reference group, invited UNISON to partner with them. And one of the interventions that BEMIS used was the use of emergency sustenance fund payments to ensure people from BME communities can receive vitally needed support and access to food and other safety supplies regardless of immigration status. I was invited to be a chair of one of the subgroups, and we are focusing on frontline workers protecting safety and rights and economic development and recovery. One of the things we did was to send out an FOI to all health boards asking for the number of staff that have had risk assessments done by ethnicity. This is to ensure compliance of that risk assessment framework. So what do we do now? What are the next steps? This pandemic is still here, but we know pandemics are followed by recessions, further job loss, and cuts to public spending. So as a union, we have to continue to follow up on ensuring that workers' rights and safety are protected. We need to come together as a union, as Congress. We have to engage and monitor progress of Scottish Government's Programme for Work, which is an ambitious plan to deal with many of the systemic and structural issues in the short, medium, and long term. An interesting feature is a measure of racism. Actually, the cost of racism. We all know one of the costs of racism is death. The tragic deaths of people from George Floyd from the US, and close to home, Mercy Baguma reminds us of this. For Black workers, COVID-19 discriminates due to structural, systemic, and structural barriers, societal barriers faced by us. Imagine we can invent a vaccine against the virus in 8 months. Yet over 400 years have passed and we are yet to find a vaccine for racism. During COVID-19, the cost of racism has powered movements like Black Lives Matter and opened the hearts and minds of many different people in a positive manner on a global scale. Congress, as activists, we have a captive audience now. There's much work to do. This is a moment of opportunity for all of us. People are listening compassionately. We have one race, the human race. So race equality is everyone's business. We cannot say, oh, we are non-racist or at least race or the least racist. We must strive to be actively anti-racist. Congress, we need to do more now. We need to do better now. Thank you.